Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis, and it's the leading cause of disability in the U.S. More women than men suffer from arthritis by about 20%, and the total cost for arthritis treatment in the U.S. exceed $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you right now the population of the U.S. did not double in that time period. There's almost 600,000 knee replacements performed each year, and by 2030, the demand could reach $3.5 million knee replacements annually. 35% of those with a knee replacement are between 50 and 69. Knee replacement is elective. It should only be performed after considerable conservative treatment, such as anti-inflammatories, prescription pain medications, topical pain creams, PT, bracing, maybe a cane. Now, the various types of knee injections that are available: cortisone, hyaluronic acid, and then you have the regenerative medicine injections, which we'll go through. Cortisone has been performed since the 1950s. They've been a mainstay and gold standard for knee arthritis treatment. At the beginning, when they were first done, it was for rheumatoid, and then a few decades later it spanned over into osteoarthritis. They don't cure anything. It's questionable whether or not they harm cartilage. That was showed in studies with small tried to show it in large animals or even humans, they didn't see that at all. Studies show 75% good to excellent overall results, and the pain relief may last for weeks to months at a time, and then they can be repeated. They truly are the gold standard for knee arthritis. Hyaluronic acid injections were first FDA approved back in the late 90s. It's the motor oil that's normally found in our synovial fluid space. In 1997, they approved the first preparation from rooster combs, and it was called viscosupplementation. So, now the trade names are Hyalgan, Synvisc, Orthovisc. None of those have shown superiority to the other. One of the largest studies in the U.S. showed beneficial effects in 80% of patients for over 6 months. So the theory is that they provide lubrication to the joint, anti-inflammation, and they compel the joint to make more cartilage, although this has not in reality been shown, but those results can't be denied, right? PRP therapy is short for platelet-rich plasma therapy. This involves a simple blood draw from a patient's arm, which gets spun down rapidly for about 15 minutes, and it concentrates the platelets and the growth factors. It then involves 1 to 3 injections into the painful knee. There are several studies showing significant pain relief, 70% good to excellent results at 6 months, and also preservation of cartilage in over 70% at 1 year. Stem cell injections truly have the potential to alter the course of arthritis and not just to mask pain. PRP therapy also falls into this category of regenerative medicine, but PRP therapy doesn't actually have stem cells in it. It actually pulls in the body's stem cells. So these treatments actually put the stem cells right into the knee. You can use bone marrow derived stem cell injections, fat derived stem cell injections, or amniotic derived stem cell injections, which are obtained from consenting donors after a scheduled C-section. These are not embryonic stem cells. They don't have the ethical concerns that we've seen in the past. There's been several studies looking at these. One study looked at 6 months after transplantation. The patient's clinical symptoms had improved, and improvements had been maintained over the follow-up period of 17 to 27 months. There are no large clinical studies. They're just the small ones, about like this one, which had 10 to 25 patients. Bottom line is that there are various types of knee injections available. All of these are low risk and outpatient. In combination with other treatments, they may help delay or avoid the need for a knee replacement, and all can be repeated every 3 to 6 months as necessary. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and offering over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com, and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.